Hello, everyone. Welcome back to my YouTube channel. This is Annie the pharmacist with another important topic today, and we'll be discussing the kidneys. That's a wide topic, so I will have to split this video in two parts. Part one will cover acute kidney injury, also known as acute renal failure, and part two will discuss chronic kidney disease. Because it's such a wide topic, as I said, I'll have to split it in two. Acute meaning short. Is short in duration. That's what that means in medical terms. Short in duration, but that doesn't mean it can't be severe. So it can be short but severe. Then chronic kidney injury, chronic kidney disease, that's persisting for a long time. So that's long lasting or constantly reoccurring. But as I said, we're going to discuss acute kidney injury today, which is also known as acute renal failure. Now, acute kidney injury can happen within a few hours or days. So, just as fast as that, it can happen. It's characterized by a buildup of waste in the body. So, the kidneys have a hard time keeping the right balance. It's common in hospitalized patients, ICU, or older adults. And the causes can be any condition or disease that you may have, like diabetes, for example, that slows blood flow. So, any kind of disease that slows down your blood flow, causing a low blood pressure, that can cause acute kidney damage. Now, for example, you have loss of fluid, blood, like bleeding, so severe bleeding, severe diarrhea. Diarrhea, you're also losing fluid right there. Vomiting, so any fluid loss that causes you to have dehydration in the body, that can cause acute kidney injury. Heart attack or heart failure, their overuse of some drugs, so some medication that you may use, for example, NSAIDs. And NSAIDs are a group of medication. They are known as non-steroidal anti-inflammatory drugs. So that's an acronym for non-steroidal anti-inflammatory drugs. They are called NSAIDs. And these drugs are like ibuprofen, which is the generic name. The brand name for that is Advil. Naproxen, to which the brand name is Aleve. You have ketoprofen or diuretics. Some diuretics like furosemide, spironolactone, there's a bunch of them out there. Bumex, that's bumetadine. They increase urine output. So if you are urinating too much, so you're losing a lot of fluid, that can also cause injuries to the kidney. Burns, major surgery. With burns, again, you lose fluid there. Major surgery, again, you are thinking of blood loss. No, you have direct damage to the kidneys, which is like, for example, sepsis, which is a life-threatening condition. Multiple myeloma, which is cancer that forms in your white blood cells. So that can also cause kidney injury. Vasculitis. So anything that ends in itis, it means inflammation. So any word you hear and it ends in itis, that means it causes that's inflammation, right? So vascular, that's your vessels, blood vessels, and itis, which is inflammation, meaning inflammation of the blood vessels. Nephritis, again, another itis right there. Nephrons are the kidneys. Nephritis, so that's inflammation of the kidneys. Then you have blockage to your urinary tract. And blockage, for example, like in men, you have prostate. If you have problems with your prostate, that can also cause injury to the kidneys. Or in females, if you have cervical cancer. So anything that causes blockage in the bladder. So as I said, enlarged prostate, kidney stones. You can have blood clots in your urinary tract, and that can also cause injury to the kidneys. The signs and symptoms. So you'll find out that you have reduced urine output. So that's a small amount of urine you're passing that's leaving the body. You have swelling in the legs, your ankles, and around the eyes. You may feel fatigue, excessive fatigue or tiredness, also shortness of breath, confusion, nausea, seizures, or coma in some cases, chest pain or pressure. So, those are some of the signs and symptoms you may feel when you're having acute kidney injury. Now, how they diagnose this is that they're going to measure your urine output. So, throughout the day, you're going to measure how much urine you pass. Also, a urine test called urinalysis is collected, it's done. Another way to test again is through blood tests, which we call BUN, which is BUN, and that is just an acronym again, another acronym for blood, urea, nitrogen. Phosphorus and potassium, we're going to do blood tests for all of that to see if they are at normal levels. GFR, which is another acronym for your glomerular filtration rate. So that's your glomerular in filtration rate. Um, Imaging tests, for example, ultrasound of the kidneys to detect anything abnormal. And then you also have kidney biopsy. So there are several tests that can be done to diagnose if you have acute kidney injury going on. And how we normally treat this is the first thing, again, it's always the same in most disease states, dietary restriction. So it's always about dieting, right? So you will have to, if your potassium is high, you have to take a decrease your intake of potassium, decrease your intake of calcium. Again, you have fluid restriction. So, of course, if you have fluid buildup, the last thing you want to do is add more fluid to it. So, you watch, we try to get rid of all the fluid buildup in the body and by using the same diuretics. And another thing now is for treatment, it is you also have the fluid resuscitation. And this part is, I know it sounds like kind of controversial, but you have, when it comes on to dieting, you have to restrict what you take in. But in the hospital, they will give you fluid resuscitation like normal saline, which is isotonic, meaning it's equal to the body, right? It's equal to the blood in your body. So they are the same. Or they give you blood protein, which is called albumin, for treatment. Because what they have to do is correct your electrolyte imbalance, and that is why they test to make sure your potassium isn't at abnormal levels or your calcium isn't at abnormal levels. For example, you will have hyperkalemia. And if you remember in previous videos, I mentioned that per means anything that's high. All right, so hyperkalemia, that's high potassium, because the K stands for the potassium, and this is on the this is in chemistry, where the K means potassium. So hyperkalemia is high potassium, and emia is blood, so that's high potassium in the blood. Also, you have hyperphosphatemia. So that is just your phosphate is high. Hyperphosphatemia, high phosphate again in the blood. Hypermagnesemia. So that's high magnesium in the blood. Hypernatremia. And in N again for sodium. So that's high salt in the blood. Hypernatremia, salt in the blood. Or you can have hypo. Now the O means it's low. O for low, LOW. O, that O means low. Hyponatremia. So that's low sodium in the blood. When your potassium is too high, which is hyperkalemia, we can give you something called polystyrene sulfonate. The brand name is also known as Kayexalate, right? And that is to reduce your potassium. So there's too much in the blood. That's how what we give you to get it down. Or you can use diuretics. For kidney infection. So if there's an infection going on in the kidney, that's gonna be treated with antibiotics. But as always, prevention is better than cure, as we always see in these videos. So what do we do first? Lifestyle changes. Maintain adequate hydration. So in order for you not to have kidney injuries or to get kidney injury, maintain adequate hydration. So drink lots of water. Avoid nephrotoxic drugs. And this just means drugs that's toxic to the kidneys. Remember I said nephro mean kidneys. So nephrotoxic drugs is drugs that's toxic or poisonous to the kidneys. And as I said, those can still be, you're not going to take too much. Of course, they're good for pain. Those are the NSAIDs, diuretics. You're not going to overdo it. Make healthy food choices. For example, eat fresh fruits and vegetables, um, fat free, or low fat products if you can. Cut back on salt and added sugars. Physical activity again is always a plus. Get enough sleep. Stop smoking if you do, and limit your alcohol intake. As we always say, prevention is better than cure. So, again, like, subscribe, and share this video. Don't be selfish. You could help someone with this information. Thank you and have a good day.